Hi everyone, thank you for watching On Call for All Kids. Today's topic is all about preparing for an emergency room visit. We'll be discussing the top things you should know about a trip to the emergency center, what a child life specialist is and when to ask for one, and other ways to advocate for your child in the hospital. I am joined by Raina Emerson. She's a certified child life specialist here at Johns Hopkins All Children's Hospital. And it's unfortunately nothing we ever want to have to do, go to an emergency center or have our child be so sick that they need to be seen in the EC. But luckily they have these resources available to them. You know, what do you see in the emergency center for kids? It's very scary for them sometimes.
Yeah. We see kids coming in for all kinds of things, but we know that based on just how kids respond to stressful situations, that coming to the emergency center is not somewhere they want to be, and that brings up a lot of anxiety, and it's just kind of chaotic, and the families are just trying to figure out what they're doing and how to get through it. So we try our best to help get them through that.
And that's a big part of your role as a child life specialist too, is to kind of normalize being in a hospital setting, which is hard to do. So your role is very important, and it's Child Life Month, so this is a great time to talk about what you do here at the hospital.
Yeah, so child life specialists are like teachers for the hospital. So our job is to reduce the traumatic effects that hospitalization can have on a kid. So in the emergency center for me, that's doing a lot of like procedural preparation. The emergency center is a place where a lot of procedures happen. Kids come in sick or injured, and we need to figure out why they're sick or how to help fix their injury. So my job is to basically walk a kid through what they're going to experience before they experience it in real life, so that way they have just a better time coping with it. They have more positive coping, their misconceptions are cleared up, and it just helps to lower that anxiety and stress that they might be feeling in anticipation of what they have to have.
And these are two props that you actually use, that you bring around to the kiddos. What are they used for? How does this help them?
Yes, so I like to use some models as I'm doing like a practice run basically with patients before the nurse or the physician comes in to do the procedure. So I have Sasha. She is a suture doll or staple doll. So she has stitches over her eyebrow, which is a very common place that kids bump their head. Yeah. She has some staples in the back of her head as well. So I will go in with Sasha and show kids what stitches are like, what medical staples are like, and use all the real medical equipment to walk them through the procedure that they're going to have. And same with Potato Head. Potato Head, he doesn't have a nose, he has a hole, and he has an NG tube. So getting an NG tube is a very scary procedure that kids need to have. So by bringing in Potato Head, I can make it kind of silly and light while also talking them through every step of the way and explaining to them what they're going to experience.
And really educating. I imagine that takes a lot of that anxiety and stress away. Really sweet things to have. If, you know, a family does have to come to the emergency center, what is something that they should keep in mind prior to that visit?
So a few things. The emergency center, we see children based on the severity of their illness or injury. So it's not like you get in line and you go in order necessarily of how you arrive. So that's one thing that parents should keep in mind, is that they could be waiting in the waiting room for a while. So knowing that, if they have the ability to, they should come prepared, especially with toys or distraction items for their child, things that they would play with at home to help make the emergency center environment just more kid-friendly and normal for them. Phone chargers, iPad chargers, an extra set of clothes if they're anticipating they might have to stay overnight. We have a few comfort things here at the hospital, and we have resources to provide to families, but anything that they can bring from home to just have their child and themselves be more comfortable, they are absolutely allowed to bring to the hospital with them.
And typically, if you've said before too, if you have siblings or something that are healthy, it's probably best to, if they can, stay home with another adult. That's better.
Absolutely. It's ideal to just bring the child that's sick or injured to the hospital, not other children, if you have the ability to, because you don't want to expose them to any unnecessary illnesses that might be floating around.
At what point maybe should they ask for someone like you, a child life specialist?
Sure. Basically, if your child, when you arrive here, is exhibiting some signs of anxiety or they're distressed, or if you're anticipating that they might have an anxious reaction based on their previous visits to their doctor or their past visits to the ED, if they didn't go so well or if they just have a hard time visiting the doctor, you can absolutely ask your nurse or the physician to call a child life specialist. I'm the primary in the ED, but we have a whole team of child life specialists that work here. So hopefully we can provide some assistance in just alleviating that stress and anxiety.
And then lastly, any tips for parents just in general advocating for their child if they are being hospitalized or end up here in the emergency center?
Yeah, there are a lot of ways that parents can advocate on behalf of themselves and their child, especially during procedures. One way is to advocate to hold their child during a procedure or at least sit next to them in a comforting position. Parents a lot of times think that if they're the ones comforting or holding their child during a procedure that they're the bad guy, when in reality it's a lot more scary for a stranger to come in. To that child, it's much more scary for a stranger to come in and hold that child than their parent during something that might be painful. So if they need to have like an IV or sutures or stitches or anything like that, that might be kind of putting them over the edge of anxiety, parents can advocate to be near to their child and provide positive support. You can use distraction too. So if a child life specialist isn't available, you can whip out your cell phone and put on like nursery rhymes or their favorite TV show or YouTube video and try to keep their child engaged in distraction during a procedure. So those are a few ways that they can help.
Because laying down is very scary to them. I know you've mentioned that before too. So if you can hold them, that is great. Well, Marina, thank you so much, and happy Child Life Month to you, and thank you for all you do. Thank you all for watching. And if you have any topics you would like us to look into, just comment below right here on this video. We can look into that for you. And check out our website. It's hopkinsallchildrens.org/newsroom. We have pediatric healthcare information and stories there for you as well. We'll see you next week.